My name is Chandra Speight. I'm a nurse at Vidant Medical Center, and I've worked on the medical intermediate unit where we've recently celebrated 2.5 years without a ventilator-acquired pneumonia. This is an amazing accomplishment for a unit that averages between 13 and 15 ventilated patients per day. We also work in a 4-to-1 or 3-to-1 patient-nurse ratio. So it's a significant accomplishment, and I'm going to talk a little bit about how we accomplished 2.5 years without a VAP. We realized early on that we had to create a unit culture committed to combating VAP. We started by doing rounds and educating nurses on the bundles. This provided us a time to identify barriers. For instance, some of the barriers were as simple as having available mouth kits. So we put into place a policy where night shift nurses would pull and label VAP mouth kits for the daycare nurses. This made it very easy when the daycare nurse came in to her busy shift, her mouth care kits were ready to go. It became an expectation and part of our culture that during shift report, nurses would go over each bundle component. This would allow them to identify if, for example, a prophylaxis had fallen off the MAR, or there were no longer SCDs for a patient. Then the oncoming nurse could contact the physician and get another order for those components. An important part of our process was teamwork and engaging all members of our team. One of our care partners spearheaded a Wipe Your Paws campaign, and for this campaign there were paws all around the unit, and if a person was seen going into a room and didn't wash their hands, that person would be reminded then, but also they would get a dirty paw in their mailbox. And if a person was seen wiping or washing their hands as they were supposed to, they would get a clean paw in their mailbox. This was a really fun way for staff to engage with washing their hands and to engage with each other and see who got a dirty paw and who got a clean paw. And it just became a fun way to talk about something that was so vitally important to preventing infection. As our staff continued to achieve months without ventilator-associated pneumonias, we started to have celebrations. The hospital gave us no VAP t-shirts. We had parties with no VAP cakes on both day and night shifts. This just helped keep staff again engaged and excited and allowed them to feel rewarded as part of this effort to achieve no VAP. Although we used fun ways to engage our staff, like the Wipe Your Paws campaign, we also were consistently mindful of how important this was for our patient care. VAP has a high mortality rate. It increases hospital length of stay. It can lead to further complications. It costs nearly $40,000 per incident, but most importantly, our staff kept in mind that following the bundles and preventing VAPs would get our patients out of the hospital faster and potentially save their lives.